Good morning, everyone. As sir have introduced me, I'm Stuti Adatiya, and I teach at pre-primary section from Genius English Medium School. So before I start my topic, I want to ask you that if anyone falls sick, what is the solution for it? Say suppose I am sick, and today is finals of Intellect Meet, I'm not going to get a holiday anyhow. So what do I do? Yes. Medicine. Anything else? Anything else we can do? Yes, sir. For a longer impact, yes, to have a good food. But the very first word comes in our mind after we hear the word sick or ill is medicines, to take medicines. This is what my topic is about. And before, it is disparate combination. So before I go to the topic, I will explain the term disparate combination. Disparate means that dissimilar or secrete. So secrete effects of combined effects of the drugs. So the impact of drugs on our body. And do anyone would like to help me with definition of drugs? Can you define drugs? Yes, can anyone define drugs? Not from the science department, I know you know it. Can anyone define drugs? Yes, ma'am. Amisha, ma'am.
It is a combination of chemicals which naturally come and we use it for our digestive system and it will affect directly on our body.
Only digestive system?
No, the whole process.
Okay. Okay. So drug basically means that there are the substances which alters the bodily functions to get the desired effect. It can be medical as well, so therapeutic as well, and narcotics as well to get the intoxicated effect. So, medical drugs are used to repair or damage the damage in our body. It is used to repair that damage. And narcotic drugs used to moderate severe pain or treatment or intoxication. Narcotic drugs are, there is a myth that narcotics are only used to used to get intoxicated. That is not true in all the senses. Narcotics, some of the drugs are also helped in medical conditions. We'll see further for that. Before we consume anything, we need to know the metabolic pathway of it. So this is the drug metabolism pathway in our body. First thing is absorption. When we consume something, our body absorbs it and then it processes it. So can anyone tell me where the absorption takes place in our body? In which organ does the absorption takes place? Small intestine, yes. Absorption, majority of the absorptions takes place in the small intestine. Drugs are absorbed in gastrointestinal tract, transported to the liver via hepatic portal vein. Then it goes to the liver and there comes our first pass metabolism. After small intestine, it goes to the liver. Liver, there is an effect called first pass metabolism. It basically means that whenever our body consumes anything from the outside, our body detects it as a toxin, as an antigen. Our body tries to refuse it. A simple example, when a lady gets pregnant, the embryo, the blastocyst, the body considers it as an antigen, and it also tries to refuse that. So first pass metabolism is that, and the term bioavailability is also related with first pass metabolism. Bioavailability means the amount of drugs which are absorbed in our body and which will work in our body. After first pass metabolism, liver will destroy some amount of drug, and it will some amount of drug will be remaining. So that remaining drug will be processing in our body. Say, I have taken 1 gram of paracetamol. The first pass effect has made it 0.5 gram. So the remaining 0.5 gram will be affecting my body. It will be going to the blood and it will be going to the organ which it needs, right? So this is what is first pass metabolism and bioavailability of the drug. Next is excretion. Can anyone, I'm not talking about physical excretion, can anyone tell me which organ excretes things? Not physically, filters the things. Kidneys, yes, very nice. Kidneys are the kidneys is the organ where blood is getting filtered. Whatever the toxin it is getting filtered in kidneys. So in kidneys, there are the filtration units are nephron. Nephron, there are PCT, DCT, proximal convoluted tubule and distal convoluted tubule. PCT does the passive reabsorption of the drug. As there is bioavailability that the remaining drug will be going to the blood, there will be PCT which will be taking the which will be reabsorbing the drug from the blood, and it will be which is needed by the body, or with the drug which is the amount which is not needed, the extra amount, it will be passed through the urination. Drug effects on major organs. Our body is a really complicated system. So I have taken the major organs that are liver, kidneys, heart, and brain. For liver, the very first things after the small intestine, blood goes to the liver. We all have seen that, right? So in liver, it metabolizes drugs. There is a risk of drug-induced liver injuries. See, drugs, as I said, have both therapeutical and have negative effects as well, right? So if the drug is meant for liver injuries, it will not get damaged, it will heal it. But if drugs are not for liver, it can also affect the liver. It can cause in damaging the cells. Yes, liver can regenerate it. Liver can regenerate itself, but it can cause the damage. It can cause fatty liver. It can cause cirrhosis and many more things. And then comes kidney. Whenever after the circulation, blood goes to the kidneys. So then kidneys filters the drugs from bloodstream, risk of nephrotoxicity. When blood comes in the contact of kidneys, as I said, nephrons are the filtration unit in the kidneys, right? So when the blood comes to it, and if the blood is extreme, then it can also cause nephrotoxicity. Next is heart. Heart, we know that it differentiates between the oxygenated and deoxygenated blood, and it passes the blood to the whole body, right? So it is very obvious that it can also come in the contact, and it can also affect the heart. Affects the heart rate and blood pressure. Normal drugs can cause these common problems. It can affect the heart rate, or it can cause high or low blood pressures. If we talk about the severe drugs, which are extreme, the muscles can be damaged, or it can be teared or something like that, right? So it depends upon which drug we are taking. In all, not only in heart, all the organs, it depends upon the drug which we are taking. Next is brain. Our whole body is controlled by our brain, right? So there are major effects in our brain because 4 lobes, many cerebrum, cerebellum, many of the glands, that which controls the whole body. So if it comes in the contact of brain, if it is meant for brain, if it is therapeutical to brain, if the drug has been taken to heal the brain, it will do nothing, it will cause the therapeutical effect. But if it is not taken for that, it can also cause damage in the brain, like it alters the neurotransmitter levels, potential side effects, and it can be severe or normal as well, depending upon the drug which we are consuming. Now, drug abuse, central nervous system effects. Central nervous system, or CNS, basically connects the brain and the body. The main nervous system which connects the brain and the body. Brain functions, it can alter the mood, perception, and cognitive abilities. See, if drug abuse, I mean by narcotics drug with drug abuse, if it is negatively taken, then it can alter the mood, it can alter the perception, it can alter the thinking, it can alter the personality, everything, whichever the part is getting damaged. Next, long-term impacts can be irreversible brain damage affecting memory and personality. Respiratory system, if there are some of the drugs which can be nasally taken, which can be injected. So if they are taken from the, if they are taken nasally, opiates can cause respiratory depression, risking coma or death. These are about the drugs, narcotics drugs, which are taken to get intoxicated. Drug abuse, cardiovascular and other systems. Heart, if narcotic drugs comes in the context of heart, it can increase the heart rate, blood pressure, risk or heart attack or stroke. See, in the very beginning, if the person is starting to get narcotics drugs, to get intoxicated in the starting, it will show the symptoms of heart rate, increase in heart rate, blood pressure, and then if the severity, if there is severity, then it can cause heart attack or stroke as well. Liver, risk of inflammation, fatty liver disease or cirrhosis. It is very common that if we consume alcohol, there will be fatty liver. Similar to the drugs. It can also cause fatty liver, cirrhosis, damage in the tissues and everything like that. Kidneys, impaired function, risk of acute injury or failure. As we know, it is a filtration unit, all the toxins will come to the kidney to get filtrated, right? So whatever the drug, whatever the negative impacts of the drugs are there, it will also cause in the kidneys, and there are high chances of kidney failure because there will be only toxins left in the blood. Drug abuse, additional systematic effects, gastrointestinal issues, increased cancer risk in digestive system, weakened or increased susceptibility to infections in immune system, itchiness or rashes in the skin, in necrosis, accelerated aging in the skin, and infertility issues in the reproductive system. Jayendra sir, can you show the video please?
Hello, I, Dr. Shreya, would like to tell you some facts about how the drug actually works in our body and how it affects the internal system of our body. All the drugs which acts on CNS can be stimulatory or inhibitory, depending on the neurotransmitter it releases and how it affects the neuronal activity of the brain. Same way, the drugs interacting with
this is the video justifying the presentation which I have given. She is highlighting the points which I have highlighted, and she is Dr. Shreya Mashru, practicing at Junagadh Civil Hospital, and she has guided me for this project, for the same. The video is incomplete because of the time constraint, and if you want, you can see the video afterwards, right? So, now, when we are talking about the drugs, they are scheduled in certain categories. As per the US scheduling system, they are scheduled in five groups: Schedule 1, 2, 3, 4, and 5. Schedule 1 are basically medically not approved and has high potential of side effects. Schedule 2 are medically approved and also has the high potential of side effects. For example, morphine. Morphine, as you know, it is a narcotic drug, and if we consume it, there will be several side effects of it, right? So if we are consuming morphine like that, it will be causing, but it is also used medically. In the cancer patients and in the brain surgeries, morphine is used because the anesthesia will not be working that efficiently. So as a sedative, morphine is used in the cancer or brain surgery patients. So Schedule 3, which are medically approved and moderate potential of abuse. And Schedule 4, which are medically approved and the lower potential of abuse. And Schedule 5, medically approved and has the least potential of abuse. And this is the US classification. Now as in India, for it is ICMR. It is divided in group 1, 2, and 3. For group 1, it is for morbidity and mortality rates. For group 2, they are for antibiotic resistance drugs, and group 3 is for multiple drug resistance. So what is the purpose behind classification of the drugs? What is the need to classify the drugs? For safety purpose, for body chemistry, for multiple drug use. See, I want to explain this with an example. Can you tell me, when a lady is being pregnant, there are 2 common drugs which are advised to her. There is a hint they are used for anemia. Can anyone? Folic acid, yes, IFA and calcium. These are the two common drugs which are advised to her. And we can, I don't know about the doctors say it or not, but it is advised not to take it at the same time. There should be a gap of 2 to 3 hours because iron and calcium are fighting for absorption. So multiple drug use. There are, this is the reason for classification because if there are multiple drugs, this is a simple example. Say suppose heart attack and analgesics, say suppose vasopressin and hyperactivity, stimulants of the arteries or neurons. So we cannot use certain drugs together. So that is why it is classified as group 1 and 2 are not meant to be taken together. Schedule 3 and 4 are not meant to be taken together. So my conclusion with this topic, with this project, I don't mean I'm not biased with any drug. Drugs can act therapeutically as well, and drugs can have side effects as well. Just go for the action of the drugs and consult a doctor before going any. Like there are 3 types of drugs: prescriptional, recreational, and OTC, over-the-counter drugs. There are which can be given to you without any prescription. There are OTC drugs. So what I want to say is go for a doctor and go for the action of the drug. Thank you.
Truly amazing.
These are some of the surveys which are also mentioned in the written one.
Amazing one. Put your hands together for her. Excellent done, madam. Stuti madam, you have done excellent. Truly excellent. Yes, your question, audience. Yes, sir.
Cross-in. Sorry, what is the?
What is the generic present in that medicine, particularly the formation?
The content is not my part, sir, because...
Okay. Then one more thing. It is advised to me by the doctor actually that I had to go for a medical allergy, drug allergic report.
Yes.
So I just want to know what goes in it, how they conduct it, that drug allergy report as to determine which medicine can be harmful to a particular person. So if you know that, then I want to know that.
If you are having symptoms like allergic symptoms, if you are having itchiness or nausea or vomiting, you must go to a blood reports which can determine the histamines in your body, and they will give you the antihistamines for that allergic reaction. And with the blood test, you can also come to know which drug will be suitable to you or not.
Okay, thank you.
Hello, friends, anybody else? Yes.
Can you tell me the difference between antigen and antibody?
Antigens are body considers it as a toxin, and antibodies are used to eliminate the toxin.
No,
Antibodies are formed in the body to fight with the antigen, and it is used to eliminate that antigen.
Can you come again? Antigens are?
Antigens are basically, if I am having, say, suppose flu, whatever the viruses are coming, that the body detects it as an antigen, and the body produces something to fight with it, right? So that are called antibodies.
I just want to correct a little bit here. Antigens are there to produce antibodies. Antibodies are nothing but small proteins which are produced by body.
That
so
is
antigens
true.
are the first shield that produces antibodies.
But
so
they are meant for vaccines. Whenever
no, it's not about vaccine. Even if I'm not sick, my body regularly produce antibodies. So
Yes.
antigens are the one which are responsible for producing proteins.
that is
which are
why
called
only
as
antibodies will be
antibodies.
formed when it comes in the contact of
But you actually
antigens.
differentiate them both, but they are actually functioning together only.
They are functioning together, but to fight with each other. Antigens are also, listen to me, antigens are even formed when we are in the womb of our mother. Because whenever mother will be getting any infections, antigens will be also affecting us, and antibodies are directly formed in the womb too. And in the vaccines, as I was saying, we are taking vaccines that are antigens which our body uses to make antibodies.
So that's what I'm saying, but you are using the word they are fighting with each other. They cannot, because antigens are only the one which are responsible for producing the proteins which are called as antibodies.
But what does antibody do? It eliminates the antigens.
They cannot, because antigens are the one of producing antibodies.
Because of the antigens, body is producing antibody to fight with it.
We need to check it then.
Yes, Raki madam, yes.
Antigens are foreign particles.
Yes.
Okay, antigen are foreign particles. We ourselves produce antibody also, and the drugs we are using as a medicine, that are the antibodies
Fight
that
it,
helps
yes.
to fight with that antigens.
Yes.
So expert advice. Yes, ma'am.
Ma'am, you have used the word hydrophilic.
Yes, ma'am. We had a word yesterday only, and
But I want to ask you something else.
Yes.
Can you please tell me what is the difference between hydrophonic and hydrophobic?
Hydrophilic and hydrophobic.
Yes, both.
Right, hydro means water, right?
Yes.
Hydrophilic means they are ready to work with water. We can, in simple terms, they are ready to work. They are ready to go in the flow with water. And hydrophobic is they will run against the water. Away, yes, away from the water.
Were you in pharma industry?
No.
Nee? You're not in pharma industry, you're. Amazing, ma'am. Truly, really excellent. Judges, your question.
I am basically from science field. I had done PCB in 12th and then SI sanitary inspector. After that, that is a one-year course in paramedics. So the inspiration behind this topic is my mother has been recently diagnosed with breast cancer and wanted to know I have researched a bit about she's on chemo right now, about the impacts of the chemo on her. So basically I had taken it in general. So she was the reason behind this topic.
Wow, great, ma'am.
Yeah, she was the inspiration, yes.
Yes, any other question, judges? You, sir.
How frequently in your family, or have you ever guided others for going for more OTCs without prescribing, without any prescription?
See,
Can you guide people, or have you in your family that habit of, and how frequent that habit is, and how far that habit has, developed, because that habit also develops with the knowledge of medicine.
Yes. As I said, I had a PCB in 12th. So before that, I was not aware about the OTC drugs and prescriptional drugs and everything. I had an interest in science. But I was like, if you are ill, you just take medicine because work is more important. And then after studying it, I get it then that we should consult a doctor first. And if there are any remedies, we can go for it before going to the drugs.
Consulting doctor, and even at times, if you really want to make, definitely this is a good presentation. If you really want to conclude, if you really wish to conclude it in a right track, right path, give it a channelized path, it has a lot of potentials in teaching people, in guiding people
Yes.
for how to understand drugs. You mentioned scheduled drugs 1, 2, 3, 4, and 5, right? People. This presentation can be extended to that,
Yes.
that boundary.
After research, I actually had a research part, but after researching this, I felt for this. But I can say stay tuned for sequel 2 in next Intellect Meet for the awareness program.
Okay. So that's the time where you need to talk to people about how to use various different
Yes.
drugs. Like schedule 1, 2, 3, 4. I mean, there are, when you in your presentation would talk about some anesthetic drugs, which can also be used for sore throat infection,
Yes.
that would make more sense.
Yes.
That would make more sense with the support of this.
Yes.
So, but a good presentation.
Excellent. India is the 5th largest producer of pharmaceutical. India is the 5th largest, and $50 billion Indian pharmaceutical market is, and India is exporting to even US, Europe, Gulf countries, African countries also. So India is having huge potential, in pharmaceutical, but will not allow you to live. Great. Guljar said, सोचता था कि मैं ही दर्द से माला माल हूँ. सोचता था कि मैं ही दर्द से माला माल हूँ. गौर से देखा तो हर कोई रईस निकला. गौर से देखा तो हर कोई रईस निकला. Thank you, ma'am. Wonderful presentation.